Welcome back. May is Stroke Awareness Month, and Ochsner LSU Health, Shreveport, and the YMCA of Northwest Louisiana will host a free event with activities for all ages. You will learn to identify the warning signs and symptoms of a stroke and treatment options. Dr. Rahul Shah and Amy Tomlinson join us now to let us know what we can expect. Well, thank you both for being here today. So let's go ahead and talk about how important it is to know about the warning signs and the symptoms.
So I'll jump in over there. Extremely important. Stroke, unfortunately, is the 5th leading cause of death in the United States and the #1 cause of disability in the United States. So it's extremely important because now we have treatments that we can offer patients if they do identify stroke symptoms early and come to the hospital early.
Who is most at risk for having a stroke? Is there one group that's more susceptible over another, different ages, different ethnicities, or walk us through that?
Stroke is more prevalent in the African American and Hispanic ethnicities, but overall with age the risk of stroke increases. The South is actually one of the highest densities for stroke just because of the diet, just because of the higher prevalence of blood pressure, diabetes, and all the other risk factors.
And so, doctor, let's go ahead and talk about some of those signs and symptoms. What does that look like? Does your body warn you before a stroke?
It doesn't warn you before a stroke, but there are some telltale signs of somebody having a stroke. So if you notice that somebody's face is drooping, or if somebody is...
Does it have to be one side or the other, or does it not matter?
No, any side, any side, yes. If somebody is having weakness in the arm or legs, if somebody's having difficulty in forming words or speaking, any slurring of their speech, those are the telltale signs, as we say, the mnemonic fast. If you notice that in a patient, call 911 because time is of the essence. Like I mentioned, if a patient shows up to a comprehensive stroke center in time, we can administer medications and treatment as well as do surgery to reverse a stroke potentially.
If you do have a stroke, are you more likely to have another stroke?
Yes. Once you've had a stroke, the risk for having another one increases exponentially. So
and then even after you have the next one, it just keeps upping the risk for continuous stroke cycles?
Absolutely, and which is why if you had a stroke, you want to control your risk factors even more so to prevent that second one from happening.
So let's talk about those risk factors real quick. You talked about diet and exercise. What more can we do?
So if you have any of the classic risk factors, so blood pressure or hypertension is the #1 risk factor, diabetes, high cholesterol, obesity, smoking or drug abuse, which unfortunately in the area that we live in is very prevalent. Those are all big risk factors for strokes, and those are all reversible. Age, like I mentioned, is a not irreversible risk factor, but everything else can be reversed or at least controlled to a great extent. And so those are the things that I would strongly urge the patients to go see their primary care doctors, go see their doctors and work on.
Okay, wonderful. So now that you've given us a little bit of information about that, you guys are having a free event with the YMCA. Let's go ahead and tell us about the details about what people can expect at that.
Sure. So we're super excited about this event. Us at Ochsner LSU Health, we're very passionate about stroke care, and we really want to focus on prevention because increasing the health and well-being of our community is really important to our area. So we decided to throw this stroke event called Be Fast for Stroke. Be Fast stands for balance, eyes, face, arms, speech, and time, which are the warning signs for stroke, and something that we're going to teach the folks that come to the event about, as well as we have different risk factor stations set up where folks can go and get free screening for all these risk factors. We'll have health counseling where they'll go over the risk factors they are positive for, as well as other vendors that will contribute to their health and well-being and help them learn different things about stroke risk factors and whatnot. We have 28 confirmed vendors.
Wow, okay, so a lot of vendors there, a lot of those going to be actual resources, correct?
Correct. We will also be giving out resources such as free blood pressure cuffs to those who need a way to maintain their blood pressure control if they don't have access to that. There'll be prizes and giveaways, things that will help to maintain their health as well. So
let's talk about some of those screenings. It's not just for strokes. What else do you guys have?
We are doing screenings for blood glucose checks, lipid screenings. We're checking for your BMI for obesity, as well as
A lot of different ones, sounds like.
Yes, yeah.
Wonderful. And then giveaways, sounds like a really good time. Okay, so go ahead and let us know, Amy, where we need to be at.
So this is going to be at the Lash YMCA
Okay.
from 10 to 2 this Saturday, May 11th. It's a free event, open to the public. Everyone is welcome, all ages. There will be kids' activities as well. So it's just going to be a fun, free event for everybody.
And Amy, do people need to register for this specific event, or do they just kind of show up?
They can just show up anytime between 10 and 2. We'll have speakers going in the background and covering a range of really interesting
okay.
topics about stroke, as well as demonstrations of healthy cooking and Kid Fit exercise routine as well. So a lot of fun stuff going on that they can participate in, as well as visiting the booths.
Wonderful. Well, thank you both for being here so much and talking to us about this free event. It's really important that we talk about bringing awareness to this and, getting involved. So I appreciate you both being here.
Thank you for having us.
Having
Of course.
Yeah, absolutely.